Well, no, because we were all trained that you just medically correct for Black patients.
What
That's
does that
how
mean?
we were trained. You medically correct. Just like, for instance, Black patients aren't supposed to be on certain medications. It came out where we were trained to medically correct. Through the studies, it came out that that wasn't true. That was just a social construct somebody stuck on these labs.
That is absolutely insane. So, is there a genetic component, or is this more systemic, related to access, income, racism in the
Well,
healthcare
it's
system?
it's kind of all of it. It's nature versus nurture. Nature is the genetic component. Nurture, and then nurture is your environment. So bad food, drinking, being dehydrated, and just a bad life will run you into kidney failure. Drugs will run you into kidney failure.
Yeah, yeah.
So
I
let
would,
me bring it personal to me also. So I think I told you all I don't have older relatives.
yeah.
One of the main issues of my older relatives was kidney failure. My mom lost half of her siblings to kidney failure.
Whew.
Her oldest sister died of kidney failure in birth with her last child. They told her with the third child, don't get pregnant again because her kidneys may fail. But
How old was she?
she was in her probably late 30s, early 40s.
Wow.
And so she had the last child and she died and left all these young kids.
Ugh.
And so, my mom raised some of the other siblings because there's so big difference between them. They raised them. She had a brother died of kidney failure. My mom ended up on dialysis.
Oof.
And before, my mom was having problems with her blood pressure, which is another big indicator. Because if you don't control your blood pressure, it puts a stressor on the kidneys, and your kidneys will deteriorate
Mm.
because fighting these high blood pressures. And they kept changing her medicine and medicine and medicine. She was like in her 50s. And then they decided to run her through ultrasound. Well, it was the CT scan of her kidneys, gave her dye. The dye killed my mom's kidneys,
Oh.
automatically on dialysis. They
Oh.
had to stop the dye in the machine. They didn't get to finish the thing because she went straight into kidney failure. They had to fly people in to actually do a bypass.
Oof.
At this point, they found out that she only had one kidney.
One
So
functioning kidney?
my
One
mom went to the
functioning
doctor.
kidney or one kidney?
One kidney.
Where'd
You
the other
have
one go?
kidneys.
Yeah,
They
where'd the
they didn't tell. Nobody ever looked. She'd had 3 children, and nobody told her that she had one kidney.
She had one kidney from birth?
That's what we're thinking because the other one, it was small and atrophied, which means it's scarred over and tiny, and it didn't work. The other kidney worked.
Mm, 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 mm.
And so this is real. This is a real issue with Black people. And a lot of us, you'll find people that are young and you find them dead.
Yeah,
It could be kidney failure. It could be uncontrolled high blood pressure. Because if you don't control your blood pressure, you will destroy your kidneys. If
yeah.
you don't control your diabetes, you will destroy your kidneys. You cannot live without kidneys.
So
Kidney
let's
failure is real.
let's talk about that though. So, because how does hypertension and diabetes, which disproportionately impact us, play into the development and the delay of catching the kidney disease?
So if you control it, so all of this is what we call vascular, which means it's your blood vessels. Okay. And so your blood vessels supply blood to the kidneys. And that's where you take everything you use, and it's like a filter. If you think like, what are those things that when you wash your salad and it drains
Oh,
through?
the strainer
The strainer. Your
or the
kidneys are
colander,
strainers. Right, the calendars. And so if you notice the strainers, it keeps out the things that you want, right?